Can you, that's better. All right, so I wanted to share with you today my journey of moving to the dark side, and it's definitely one that I don't regret, not coming back. So what I thought I'd start with is explaining to you a bit about what venture capital is, because it's certainly not something that I knew about at medical school, and I think the most exciting way to probably explain it is that we get to help change science fiction into science fact. So does anyone know what this great innovation is? No. It's needleless injection, so hypo spray from Star Trek, which what I was meant to ask you is that science fact or is that science fiction? And the thing is, this is one of our inventions. So it's a company called WAMSS that is developing a needleless injection system based in Queensland. Next one. Thanks, Mike. So science fact or science fiction? Hands up if it's science fiction still. Also, I guess I probably should have explained what it is. So you put it next to the patient and it just tells you what's wrong with them. So no, it is becoming science fact. So this little health patch is a device that you can stick on the patient's body and it gives you an ECG. And then this one is also one of ours. So this is diagnostics, which was started out as an ultrasonic stethoscope, but it's basically a tiny little ultrasound machine that they're using as a bladder scanner now. And there's actually a competition in the US that's towards the development of a real tricorder that I think is a couple of years off having the results. And then finally, this one is a non-medical one, but anyone know what this one is? Mike again? No, universal translator. So you can put it in front of the alien and it will, whatever language the alien speaks, it will translate it into whatever language the Star Trek people speak. I'm not a big Star Trek fan, which I probably shouldn't admit. But anyway, this one I also got to work on. So Mike would remember this one. This is a company called LingoPal. So at the start of the App Store, one of our investments was in a company where a guy had developed an app that could translate any of 42 languages into any of the other 42. So it's a travelling phrase book. And you could choose your phrase and then play it in the language of the country that you're in to get someone to do something for you. So what am I passionate about? I'm passionate about helping more people understand the great medical innovation that occurs in our state. And for me, that's about making people more aware of what actually happens here. And I don't know if this movie is more recognisable to anyone here. Yeah. So does anyone know the name of the WA medical innovator who has a role in this movie? Yeah, thanks. That's very exciting because I was kind of excited when I was watching Contagion and saw Brad Pitt, Matt Damon, Gwyneth Paltrow, and then Dr. Ali Hextall says, I'm going to do a Barry Marshall as she injects herself, which I think I almost fell off the couch. But Barry's not the only one. We have awesome medical innovation that occurs in the state that's impacting the world, but not very many people know about it. So aside from Helicobacter, we've got companies like Orthocell that are taking tendon cells out of your knee, growing them up in the lab, which takes about 4 weeks, and then they inject them back into rotator cuff tears, tennis elbow. We've got another, I don't know, has anyone had a rotation at the Royal Perth Department of Radiology? Yep. Anyone seen the guy with Bansky on his shirt? Yeah! So I remember I was looking at a catheter technology from Royal Perth, and the person who invented it, Dr. Rob Hart, was saying, oh yeah, well, a great case study is the Bansky catheters they're used around the world, it's so awesome. And then we went to the tea room and I'm like, oh, that guy must be sponsored. He's got Bansky on his shirt. He's like, no, he developed it. So we're really trying to get more knowledge in WA of the great stuff that happens here. And as part of that, I've been involved with Mike as well in a program called Spark CoLab. That it's great to see some of the people who are in the design course in the audience tonight. But basically, Pete Santamaria, who is another ex-WAMSS president, also went to Stanford. He's an ENT surgeon and scientist. And he left Perth with no entrepreneurial desire or ambition and came back with 2 startups, having done both the biodesign program and the Spark program at Stanford. So a year ago, he came back to Perth And it was certainly something that I wanted to be involved in, because I think that whilst we have this excellent innovation and people who recognise problems and have great ideas, we don't have the support systems for them to be able to get those entrepreneurial ideas to the market. So both the Spark courses really help with that and help create more people who have the management skills and the knowledge of the entrepreneurial process. And so I guess then what I thought is I'd briefly touch on how I got to where I am. So like Dan said, I did a 1.5 years of an internship and a resident job after medical school, and then I thought that was enough for me. After I loved the first 3 years of the science, and then 4th year, I realised that I didn't think a medical career was what I wanted to pursue, but knew that I had to continue, graduate, do my internship so that I had more options, and it wouldn't have been a waste. And I'm very, very glad that I did that. It's allowed me to pursue all the other things that I wanted to do, and at the same time I've always stayed being a surgical assistant as well, so I still every second Friday go and pretend I'm a doctor and help sew up patients in the orthopaedic theatre. But what I did is I did my MBA at UWA as well, and I thought at the time that I wanted to get as far away from medicine as I possibly could, but realised over the 2 years of the course that I really loved the science and was lucky enough to do the venture capital unit that was offered at the time, and realised that that was the best way to combine my absolute love of science and my inner and outer nerd with the business skills that I was learning in the course. And it was during the MBA lectures and part of our presentations to the venture capital panel that I met Matt, who you saw in the photo, and my other boss, Rob Newman, who were very happy to take a risk on a young doctor who'd done their MBA. Would I recommend doing the MBA? Dylan asked me that earlier. I definitely would if you're wanting, and I'd recommend it at UWA if you're wanting to stay in Perth and have a career in Perth, because it's about who you meet. And I also found that during medical school I had very much tunnel vision. I loved most of it, but I really didn't have much of an understanding of life outside of medicine. And for you guys being postgrads, that might be, I'm sure that's completely different, but as someone who entered medicine at 16, I really didn't have that understanding. So the MBA was awesome because it really gave me other ways in which to think and in which to solve problems. So yeah, after the MBA, I worked for a year at a local diagnostics company, and then I got the job at Stonebridge Ventures. And now for the last 5 years, I work for Brandon Capital. So Stonebridge Ventures was a generalist venture capital fund. We invested in all new technologies, and we had a strong IT focus because Rob, who was the boss, had invented the way that when I was working at Stonebridge was still used around the world to transfer really large data packages over the blue cable, so the Ethernet cable, which is pretty cool. And he did that at UWA, and then he took another technology from Curtin University to Stanford. So he was excellent to learn from, and I learned a lot about IT there. Brandon Capital, we run the Medical Research Commercialisation Fund, so we look after 60 medical research institutes around the country. I look after WA, which has the Perkins, Telethon Kids, and the Department of Health. And we act as both a funding partner, so we've got $300 million of funding, that's all superannuation fund money. And we invest those in companies we invest really early, so we invest in medical research ideas that we believe will meet a global problem, that they've got science that is relevant and competitive on a global scale, and obviously they have to be able to have the ability to make a return on our investment. Do I love my job? Yes. I wouldn't change it for the world. I love the fact that every day there are new problems to be solved, and it definitely, one thing I didn't feel medicine gave me was the ability to be very creative. And I certainly find that the industry I now work in, you have to be creative, otherwise you wouldn't really want to go to work because there will always be a new problem waiting for you in the morning. So I think I've got 10 seconds left, so thanks very much for listening to my story.